Welcome. Thank you so much for joining us again this year to the Associates Network. Can I just get, you can hear me, yes? Yes, great, wonderful. We had a pretty busy program last year and the symposium included. And so we're getting back on our feet this year with sort of in the works of another symposium in Manchester, hopefully, fingers crossed. And then a few more sort of lunchtime discussions and things like that. So there will be a chance mid-year, hopefully, for everyone to come together and see each other in person. But for today, we have a lovely little sort of session on community engagement. And I'm going to pop that over there. Lovely. So today the agenda is, how would you use a code of practice? We have Melissa Lacide here, who's our Senior Engagement Officer at the Quality of Life Foundation. We're going to first kick off with a little bit of background into our Community Consultation for Quality of Life, what we call CCQual, with Ruchit Purohit from the University of Cambridge. Melissa's going to talk to us about our Quality of Life Code of Practice for Engagement, which is in its beta testing phase, and it's a dynamic sort of process, which has been hugely insightful. And then we're going to have a Q&A with Simon Martin, who is a project officer at Richmond Council. You will have time to ask questions. How would you use a code of practice? We'll be asking you those questions. And so the chat is always open. Melissa will definitely be picking some questions out of there. And please do, feel free to speak up, especially after the Q&A, to join in the discussion. I'm going to hand over to Melissa now. So thank you so much. Melissa, you just have to unmute a second. There we go. That's better. Great. Okay. Yeah, that's Great. It.
Hi, hi everyone. As Anik said, I'm the Senior Engagement Officer at the Quality of Life Foundation. Some of you will know me, some of you won't, but it's nice to have you involved. I think without further ado, we'll get cracking, and it's my pleasure and delight to introduce you to Ruchit Purohit, who's a Research Associate at the University of Cambridge, and he'll give you some context around the community.
I think Melissa might have frozen. Is she frozen for everybody else?
Yes.
Yeah. Okay. I do know that she had some internet issues today. So I'm going to hand over to Ruchit. Are you there, Ruchit?
Yes, I'm here.
Wonderful.
Yes. Okay. Hi, everyone. Yeah, I think we lost Melissa, but I will wait. I'll continue with my presentation. Is it with you, Anik, or is it with Melissa? To click next, I mean.
There it is. Is that okay?
Yes. No, I'm saying who will be. Yeah.
So, that would be me. Yep. Yeah.
You. That's what I just wanted to check. So if you could just go to the next slide. So my name is Ruchit Purohit. I have been working as a researcher for Cambridge for a year now, but prior to that, I was hired by University of Reading to work on the project Community Consultation for Quality of Life. It was a 4 nations project where we partnered with universities of Reading, Cardiff, Ulster, that's in Belfast, and Edinburgh in Scotland. So what we wanted to test was, Anik, can we go to the next slide? Yeah.
Is that okay? Or the next one?
I can't see the next slide, sorry.
Oh, this one?
It's still on the second slide. I don't know why. Yeah.
I've got Community Consultation for Quality of Life.
Yeah, we still, I don't know if about others, we still see the second slide. That's what I was just.
Okay, here we go.
Anik, you may be sharing the wrong window, I think.
Okay. All right. Thank you. We're going to try and do this now. Okay. Is that okay?
No, sorry.
Nope. Okay. I'm not sure. Which one are you seeing, Ruchit?
I'm still seeing the agenda for the second slide number 2.
Okay. All righty. We're going to stop sharing and go ahead. So, is that okay?
Yes, that's working now fine. So if you could just go a slide before
Mhm.
and one more. Yeah. Perfect. Yeah, so it's not clear over here, but it's fine. I'll just go on with this now because we don't have much time. Yeah, so as I mentioned, it was a Four Nations collaborative project between Reading, Cardiff, Edinburgh, and Belfast, and we were testing three big concepts. One was the concept of the urban room, the other one was the social value mapping, and the third one was the quality of life framework. And we tested this in the format of launching digital mapping tools through the commonplace websites in each of these places and neighborhoods for 4 weeks each. And we went to these places in person. We launched the urban room. Anik, if you could go to the next slide. Yeah, so this is how the test took place. So we launched an online consultation. We launched the urban room. The urban room went on for 4 weeks. It was, as I said, a test. But what we were asking people was to drop pins on a map and tell us the places that they value most in the neighborhood. It was to, of course, generate legacy maps of the neighborhood and the city, but also a way of engaging with people in terms of what do they think of public participation. Participation in planning, also how many times they've ever participated in a community consultation exercise before, and if they have not, why have they not? So we were collecting three kinds of surveys, if you mean to understand, but we wanted to know how and why do people step out of their homes to participate, and it was not always easy because for years or decades, participation has progressed very far, but to get people out of their homes and come in and participate in these kind of community consultation has been challenging still yet for developers and architects and the industry as well. So we were parallelly running sessions like walk-ins, walk around the cities, or arts and cultural sessions, exhibitions, debates, talks, seminars, which were not just related to the consultation, but something for the community as well. We would close the urban room in 4 weeks, but the online consultation will go on for a couple of months more. And what came out were a series of publications. One publication which was very relevant was a literature review on participation in planning in the UK. So we collated all the grey literature as well as academic outputs in the previous 10 years, and we came up with a literature review. Then we came up with, when we were doing these urban rooms, we came up with 4 different local urban room reports, and which also helped us come up with an inclusive design toolkit. All of these reports are on the CCQOL and the Quality of Life Foundation's website. And this led to the code of practice, which Melissa will introduce. Anik, next page, please. So what this kind of just shows is the 4 different approaches we will there was one common thread, but also 4 different approaches towards the 4 cities which we were working with, and they came up with their own marketing strategy, logos, branding, the way our nation functions in terms of devolution as well. So let them take lead and let the neighborhood decide what they wanted. If you go on the next page, please. Yeah, and this was just a series of programs which took place, and each city decided to take host sessions with local groups, community organizations, businesses, the way they saw fit between those months or weeks when we were hosting. Next slide, please. Yeah, so we tested 4 urban rooms, 17 weeks, hosted 116 sessions, engaged with more than 5,000 people. And on the website, we had, as I said, 2 different surveys going on, and parallelly we were collecting semi-structured interviews, but we got 2,500 contributions, 1,500 pins on the maps, and 900 participation surveys. Next slide, please. Anik, sorry. Yeah, so as I said, we're now working towards the launch of the new Cambridge Urban Room. So we've tested these 4 places, and now we want to launch something which is a longer version of what an urban room could be. So that test is going to take place for a 6-month project in Cambridge this year, and then for another 3 years starting January this year. Next, please. Yeah, so this just kind of shows the outputs, and it was amazing to understand there were so many places that people loved, but also to see through the lens of the Quality of Life Foundation's framework. So places where they felt a sense of belonging, places where they went to connect with nature, or where they went to feel healthy, where the transport system was functioning or not functioning, places where they felt a sense of wonder, connect with people. So you can actually go and access this websites. Again, the links are on our CC-Call website. Next. Yeah, so I think that's my quick presentation. So Melissa will talk about the code of practice, but there were a lot of learnings, and I would deeply advise you to go and read all of the reports, or at least the executive summaries of all of this. Thank you.
Thanks, Ruchit. That was a really nice overview. I have popped a message in the chat for everyone, so if you've got any questions as we're speaking, feel free to put them in and we'll present them back to the speakers, Ruchit and Simon. But as Ruchit said, I'm just going to provide a little bit of an overview around the Code of Practice principles, which, as he said, came out of the CC-Qual project. I'll provide a little bit of context, but as I'm talking through the principles, have a think about some of the challenges that you face and opportunities that you face in your context when you're engaging in communities, but also when you're working with clients who engage with communities. And hopefully that will start to get you reflecting in this moment, but also feel free to pop some comments in the chat. So the Code of Practice, this has been created on the insights and the experience of community consultation and engagement, and what we know will be effective. And the research that Ruchit was talking about is an example of providing evidence around that. It has been created in the context of development, planning and design, but it's actually a really useful tool for anyone who is working in any aspect of engagement within the built environment and the housing sectors. So the principles are designed with, I guess you could call them sub-principles. So I'll just talk through them to give you some context. So when we talk about being accountable, it's about having a positive impact in communities and ensuring that the practices that we do, that those are sustainable and ongoing. When we talk about being inclusive, we're thinking about ways of understanding the diversity that exists in communities, the different ranges of perspectives that comes from people's lived experience, and also respecting those local customs and traditions, all with a view of tapping into and unearthing what already exists there. When we talk about being transparent, it's about sharing your goals and the ambitions and the approaches as part of the process and the project, as well as the learning that you will gain from the invaluable community conversations that you'll be having. Being timely is very much about giving people the time to get involved, to have those meaningful discussions, but also provide feedback throughout the project lifecycle. Supporting mutual learning. This is very much around building trust and shifting those power dynamics in a community and ensuring that the conversations are two-way in that relationship. And also that it's really clear for people who are in those communities to have clear routes for how they can get involved, how they can shape the process, and have clear information to make decisions that they're informed about and making informed decisions. Demonstrating impact. This is just around working with communities to define and refine the goals of the projects, but also sharing if and how their feedback has actually changed anything or shaped anything. And publishing feedback is around making sure that there are inclusive avenues for people to get involved, and that it's around measures that are tangible in order for meaningful actions to make a difference and take place. So ultimately, all of these principles are around helping people who are engaging to become effective, having clear purposes and routes for people to influence, but also really being clear about the scope and limitations of that process and gathering those feedbacks in feedback loops in ways that will genuinely shape outcomes in communities. Anik, the next slide, please. So we want to be transparent in our discussions around the Code of Practice and state that it is a Code of Practice that is not an industry one, but it's the Quality of Life Foundation signing up for an approach and a way of working. So we've been really excited to share the code of practice and beta test it over the last few months. And this is with community engagement practitioners, but it's also around those who are carrying out engagement as part of their role. The reason why we went through a beta testing phase was to make sure that it's a useful tool for people who are seeking to engage well with residents and communities, but also thinking about what works and what doesn't work in their context and how they can improve on that. So back in December, several organisations spanning the private, public and charitable sectors and the sectors that they work in, they tested the code of practice, and we had a few organisations who were our critical friends. We also ran a workshop, and with them and with those insights, we were able to capture reflections and further think about how the code of practice will help people in an engagement setting. So the idea around this was to ensure that there was learning from people and organisations in order to help others and make this a useful tool. As part of the code of practice, we see this as an opportunity to offer support to people and organisations, and this is all currently being developed. Next slide, please, Anik. So as part of the beta testing process, we asked organisations and individuals to complete a checklist, and this had 35 questions, and this was enabling them to self-reflect on the principles and the sub-principles. This was a way for them to better understand whether or not the engagement activities can and can't be done in their practice and why, and helping us to create a baseline around what good practice looks like for people who are doing good practice, and also have a starting point to compare that across practitioners and sectors. Our critical friends were also invaluable in this process, thinking about pushing us to think about what the strengths, weaknesses, opportunities and threats were through this process. We do acknowledge that the context of community and place varies, and that good practice is about the things that you know will work, whilst excellent is around improving on that and being more effective. So in terms of the things that stood out, there were various things that came out of the beta testing, and we wanted to also involve the associates today in a conversation around what works in your context and what you find most challenging in your consultation and engagement work. So do feel free to pop those in the chat and we'll come back to those questions. I think it's time, Anik, to introduce Simon. I'm delighted to introduce Simon Martin, who's Project Officer at Richmond Council. He'll talk through the Community Ambassador Programme. Again, please do pop your questions in the chat and we'll circle back to these. Thank you.
Great, thank you, Melissa. And thank you for the opportunity to come today and talk through what we're doing at Richmond. Having read the code of practice, I almost think this is quite a simple discussion, really, because why wouldn't you be doing these things if you wanted to be successful in your community engagement? I think that's, you know, that kind of is the question we should be starting any discussion with, really. At Richmond, we've got a new project which is a bit of a one-off at the moment, and it is quite challenging, but I'm employed directly by Richmond Council to work with residents of the social landlords in the borough to encourage them to get involved in the decisions, the activities, all the kind of things that could be measured successfully by the code of practice. It's an interesting challenge because ultimately I don't really have any authority or power. All I can do is encourage, nag a bit, bully a bit to get the landlords to adopt some of the good principles, which means that they can show that they are doing the best for their residents. And this means that I spend a lot of time in meetings. I spend a lot of time trying to bring people together to look at a green space and see how that could best be utilised on an estate for residents. Making sure all the time that the community ambassadors are involved in those discussions. And the reason I would support the code of practice is because it enables me to be clear about what we expect the deliverers, the landlords, to be doing, and it enables us all to agree how we're going to judge some of this work. It gives us a very good benchmark, which means that we're able to say, that this has met the requirements of the 200 people on this estate, or whatever it might be. Perhaps the age-old challenge, I think, is that too many parts of large organizations don't talk to each other. And so you get housing managers who don't really talk to developers, who then nobody talks to the repair service, and so on. And you get this situation where the residents feel that they fall in the middle. And my function, my role, is to try and make sure that we get through that, and that we get everybody talking together. And it does make life easier. And I think people are sometimes quite surprised by that, but it makes life easier if you're all sat down together, agreeing from day one what it is you want to get out of the project, what can be the result for residents, what can be the result for the local community, and so on. And adopting large parts of the code of practice would be an easy way to actually judge whether you're doing that well. I liked within there the supporting mutual learning, which I think is something that doesn't go on often enough. I think that organisations are far too reactive the whole time, and people then spend a bit of time talking about how we're going to be reflective at the end, and we're going to learn these, and then of course they don't. They just pick up and get started with the next project, and so on. So if things like mutual learning were built into um, a project plan, I think that would be a very useful, a useful tool. And I do think some of the figures that Melissa shared shows that we've got a way to go yet. I'm not sure if I'm interpreting it right, but 10% of nearly 10% of people said they couldn't or wouldn't be inclusive in the work they're doing. I think that shows that there is still some work to be done, really. And there's also the issue that certainly for housing associations, for councils and so on, the regulators rules are changing. They haven't of full-on constructive engagement with local people. So that can only be again a positive reason for adopting something like the code of practice. I don't know whether there's much more to say, really. I'm happy to talk to people. I suspect that the Richmond project's a bit niche for people, but I'm happy to answer any questions on that. But I'm happy to get involved in discussion about taking the code of practice forward. Oh,
Thank you, Simon. Yes, we have a question in chat, which is from Charlotte. Charlotte, would you like to ask a question?
Hi there. Hi, Simon. Nice to meet you. I had a question directly to you, if you don't mind. This is probably a little bit kind of selfish because it's a little bit of a personal question in that. So I'm here today in my capacity as with the Quality of Life Foundation, but in my other life, I am a well-accredited professional. So I speak a lot around things like air quality within properties, and I'm an expert witness quite often in court cases around the issues of mold in property. But I'm also a private landlord, and I have issues a little bit at the moment with Southwark Council because we're in a little bit of a battle around a property that I own that has mold issues with it. But but the council, I appreciate this is a completely different council, so, but the council refused to replace the windows, even though they've been paid to do so. So my question to you really is like, are councils in general forming a different department that is better to approach with this kind of issue? Because so far I've just been pushed back by the home ownership teams who refuse to actually kind of enter into any dialogue around this issue. So I kind of literally never seem to solve the issue.
With the caveat, obviously, that I don't know anything about how Southwark works directly, I would think that the best people to try and talk, you need to see if most housing departments or housing associations have established damp and mold teams.
Okay.
And that's probably, and they will be based within repairs or maintenance, something like that. And I would think that's probably the best place to go to first.
Okay, that's useful. Thank you. I didn't know that, because I'm wondering whether there's anything coming down the pipe in terms of how do we hold individual teams or stakeholders responsible for doing their part of the work.
You need to look at the Housing Ombudsman's website, because they have prioritised the whole issue about damp and mould. I'm not sure, as you're an absentee landlord, I'm not sure how that, you'd have to give it a good read. But that, if I was you, that's where I'd be starting.
Okay, great. Thank you very much.
Thanks, Charlotte. Is there anybody in the associates group that would like to ask another question? We had a comment from Oliver, which is great, but he has now left. If you have further questions, please put your hand up and direct them to myself, Simon and Ruchit, in particular around the code of practice.
Okay, can I ask a question? Is that allowed?
Yeah, of course.
What's the plan next with the code of practice?
So we are in the process of putting together all of the insights from the beta testing, some things that came out of our critical friends, and also the workshop that we recently ran. And the idea is going forward, we will review our code of practice document to make sure that it is reflective of the feedback that has been shared with us and making it the best that it can be. We've also got an inclusive engagement toolkit, which goes hand in hand with the code of practice as something that people can use in their context and apply in different ways. So we'll be updating that. The inclusive engagement toolkit was put together as a result of the community consultation for quality of life in the first place in that project. So it will just be an updated version of that. And there's been lots of appetite around training and support. That has come from different organisations and individuals across the sectors. And so we're working on how best to do that and support organisations and individuals practicing. So more to follow on that, definitely in the next few months. So yeah, thank you, Simon. Anique, can I hand over to you if nobody else has got any questions?
Actually, I had a brief question, if you don't mind. I was just curious around I haven't had a chance, sorry, to look at the CC Qual website, but I was just wondering whether you found that there were quite a lot of similarities in the different areas that you were running the kind of consultation process, if you like, or whether you found that there were kind of very specific issues to kind of, or specific needs to different areas depending on the geography, etc. And also, how best is it for the public to engage into each different development project in the future? As in, have you identified like the best way to do that? As in the best kind of means that they're going to engage into the people that were actually developing the project? Does that make any sense? Sorry, that sounded like a really jumbled question then.
No, that's fine. I think, Richard, you could probably answer the first two, and then we'll circle back to the third question.
Sure, yeah, yeah. And if I do forget, let me, I think Melissa will be great at this as well. Yeah, no, see, we did go with a lot of planning in this. And as I said, the best was to partner with groups or project teams who were already in the neighborhood and people who've been working in there for, if not months, at least years, sorry, if not years, at least months. But and then them partnering with local organizations. And one of our learnings has been that how do you, what happens when a consultation ends? And where does all that data go? But not just the data, all the relationships and networks which have been built with these local groups just die down. How can we carry on continuing these relationships? So whenever there's a next consultation, you piggyback on that one. And the good thing was that each team in these local contexts saw the project as a national project, but also something which they wanted to do something for the community. So Cardiff hosted the urban room in a deprived neighborhood where there was a newly built community center, which was not actually a new community center. It was a newly regenerated community center, but it had a different demographic compared to the whole of Cardiff. Compared to that, Edinburgh tested the urban room in a space which was an unused shop behind a cafe, but they also had pop-up centers at the peripheries of Edinburgh, and one in a village hall, church hall kind of context, and one was in an art center. Belfast took a tiny corner in a cultural venue which was recently refurbished by the council, which was earlier a Tesco, and before that, like a commercial building. So in a beautifully, so it wasn't the city center, but it was also a beautiful heritage building. So each urban room was perceived differently by different people. And this I was talking about in terms of physical context, but also how communities function. So in terms of Belfast, we were asked by the university there saying, you need to be wary of how you approach people and what you talk. So do not talk behind the remit of this, because they have a different context in terms of their history and how they perceive. But in sometimes it was better as us as people doing surveys, because people saw us outsiders, and sometimes they're like, oh, it's better you not being from the other part of Belfast. I would rather talk to you. So there were different contexts in that way as well. But also we what we realized was that we had to constantly evaluate our work every week, and see why on certain days we were getting more consultation surveys completed, or the pins on the map, or certain events were getting more number of footfall compared to other events. So that worked also because how much of the past work in terms of the 4 months before to the launch of Urban Room, how much work we had done with different local organizations. So we'd hired a community partnerships manager in each of these places. Some of them were born there, and like for example in Cardiff, one was a researcher who was researching this was in case of Belfast, where she was researching that area for 5 years. Compared to that, Edinburgh had somebody who was from outside, from US, who had worked in the political policy sector for more than 10 years. So they had all the necessary skills, but they struggled to form all those relationships. But then she used the local bodies to get those relationships. And initially we had some kind of pushback from what they call is these community gatekeepers, saying you cannot approach the community without us, and especially if somebody is from outside the nation. But I think after a couple of meetings and trust building, it was easier. So if you read through the local urban room reports, you'll realize and especially from the learnings of each of these community partnership managers, they've written an editorial in each of them, that there was no one way, but we tried to then summarize it all into the inclusive toolkit and follow up to the code of practice, now we call it, that at least we should have these 6 or 8 bare minimum principles. We also tried to not call, so when we're collecting these questions on neighborhoods, we tried not to get bad feedback. So it would have been easy to say what you don't like in your neighborhood, and we would get really bad areas, and usually it leaves a bad taste. So what we wanted to ask was like, what do you value in your neighborhood? And similarly, so that was the survey, but when we also produced this document, we did not want to say in code of practice uh, what is bad or what is good. We wanted to say what is good as the bare minimum, and then how can you reach excellent. So that's something which we really wanted to work with the community and build that kind of conversation around the neighborhoods. Sorry, Melissa.
No, that's great. Thank you, Richard. Hopefully, Charlotte, that answered your question. Can you repeat your third question? She said at the end of the two
if I can
questions.
remember it. Really, just what I was trying to kind of get clear in my head is that from some of the kind of community work that I've had to do over the years, one of the issues was in a lot of towns, etc., wherever we're focusing on, they're always great organizations doing great work, but the issue that I've had as my experience is how do you bring that all together? And so that basically people are all kind of working as one rather than in silos. So I kind of really just trying to get my head around if I'm a kind of member of the public and, for example, I'm kind of wanting to maybe engage with something around some issue in my community, is like, where is my first port of call, really? And I guess I'm just trying to work out whether you're trying to establish like one place within each community where people can go to kind of like as their first port of call of a community engagement, or whether that will change depending on each development or each project. Does that make any sense?
Yeah, I think so. I think it's fair to say that each community is different. Each community setting and neighbourhood is different. So a lot of the work at the start of the process is around understanding what those assets are in the community. So it's the people, it's the social networks, it's the social connecting spaces that people would go to for information, but it's also not forgetting that there are online communities as well. So if you are able to put those things together at the start, you can also put together like an asset map and start to think about how to involve people inclusively as part of that process, and people will start to come through. There will also be partnerships when you do community development work, for example, or engagement work. There will be those partnerships that already exist or that are bubbling away in the background. That is around bringing all of those people together, having those conversations, and similar to what Ruchit was saying about building those trust and breaking down those barriers and walls and continuing the conversations. So it is hard work, but it's worth it when you've got those really basic things in your toolkit to bring people together. I would just like to bring Simon back into the conversation, if that's okay. Just thinking about the 8 principles in the code of practice. In your context within Richmond Council, what would you say is the most challenging for you when carrying out your community engagement with the Community Ambassador Programme, for example?
Thank you, Melissa. In some respects, I think it's often hard. It can be more complicated to demonstrate impact, and I think that getting agreement at the beginning about what are the goals and what will be the results that everybody wants is very useful. Because the nature of this beast is the council plus 4 or 5 different landlords plus various different residents groups, actually agreeing when a project's finished what the impact has been and that kind of thing can be quite a challenge. So I think probably I'd go with that.
Thank you so much, Simon. I'm going to open it up to the rest of you actually and ask the same question in your own engagement activities. Which of these 8, and I've just put them in the chat, which of these 8 have you either found the most challenging or that you think you would need support on? You can pop it in the chat, you can say it out loud. Which of these is sort of challenging you the most? Silence. Paul.
I used to be a lecturer, so I hate that moment of silence when you ask people stuff.
I appreciate that.
I think for me, I think the one that I find really tricky, which shouldn't be really tricky, but it is because of the complexities of situations, is around transparency. Because I think sometimes working for a client, it's difficult to understand or to have their full backing of what's going on and where the sort of areas for negotiation are and what's already been fixed. So I don't know whether, it'd be interesting to hear what you're like. I mean, I totally think transparency is sort of, needs to be there. It needs to be part of being human and having a relationship with a community. But I suppose formally as a researcher, I could always be transparent because I was in total control of where things went and how they were. Whereas I suppose in the work I do, I guess that's the one bit I struggle a little bit more with, because I'm not always able to be as transparent as I want to be. I don't know whether anyone felt the same or whether that came up in when you developed the code. And I know you had, I think it was about 10% said no on that one, I think, from memory. But
thanks, Paul. Yeah, that's definitely something that's come up before. To give some context around the being inclusive element, that was around organisations and individuals perhaps feeling they don't have enough time to really understand the demographics in a place to reach people. So that was kind of presenting a barrier in itself, and also project timescales and budgets and processes not always allowing people to do that. So it's definitely worth bearing in mind that that's just a reality sometimes, but that's not to say that you can't overcome that barrier with quite creative ways of engaging. So thank you.
We've got Lucy with a hand up.
Yeah, I just want to say thank you for all the presentations. They've been really, really interesting. I think just to build on what Paul was saying, I think transparency can be difficult, and I think so can publishing feedback. And I think they're kind of, for me at least, on projects, they've been quite related. And I think sometimes that has to do with working with a client and they don't necessarily want or feel comfortable with things being publicly available online, and what your limitations are as a practitioner. Like, you're not always the one who's able to make that call. And so I think that can be challenging. And I guess as well, sometimes timely is also to do with that. I guess sometimes it's being as a practitioner, sometimes you just get kind of stuck by other people's decisions.
Thank you, Lucy. We have a comment from Alice in the chat, being accountable and being timely. Can you share with the group what you have in terms of your perspective on that, please, Alice?
I think on accountability, thank you very much for the presentation. On accountability, I think organizations face, including universities and organizations, face a difficult thing about being accountable to the population, to the community groups. For example, most of the things are done as a one-off, and there's nobody who comes back and tells them what, if it's a research, what has happened afterwards, what are the outcomes of what we did. And that has a great impact on people, because when you don't do that, next time other organizations or yourself, you come back, they lose the trust. So it's quite important that accountability is actually enforced in some of these places, because it ends up being an extraction than a collaborative way of working. Be timely is one of those things when you're doing some of the things which mainly has to do with participatory or co-production. It sometimes will not be effectively timely. Also depends on the funding, where it's coming from and how many months you have, because when you're working with the population or communities, it's mainly about them that is centered, and our own ways of working might be the project has to finish within 3 months, or at a certain time, and you don't get people to sort of squeeze them out as quick as possible. And being timely is one of those things that becomes difficult because it all depends on the funders. It all depends on the on the project itself. So those are quite challenging things when you're working with communities, I think. Thank you.
Thank you, Alice. Yeah, it's probably not surprising to hear all of these, actually. It's things that we have heard from practitioners and organisations before, but it's also really nice to hear from you as well, that these are the challenges, these are the barriers, these are the realities that we're facing around perhaps implementing a code of practice, in terms of we would like to be able to do this, but the clients or organisations that we work with, there might be barriers within that. So thank you. Has anybody else got any questions that they might want to pop in the chat, and myself and Anik can bring you into the room?
I suppose the only other thing to note was during the beta testing phase, we had some really interesting takes on the actual code of practice itself. So there was an organization who had created a matrix to sort of translate the code of practice into a big Excel spreadsheet. So that it is a flexible kind of idea, and we'd like to see different people take it on and how they use it themselves in their own organization. So I think it's that question of like, how would you use a code of practice if or when it launches? Sorry, go on, Melissa.
No, that's a really good question. Question to the room, I think. Maybe Simon could kick us off, give him a bit of context around that.
I think there's definitely scope for us here to use code of practice to benchmark what's going on in the various projects that we are involved in or that we're encouraging to get going. And so I could see us adopting these principles as a way to test whether or not a project is successful or not at the end of the day. And very much along the lines of it being a sort of measuring tool, benchmarking process. And obviously, just some things could be different, because there will be some projects where something might not be, that there might not be an issue about one of the principles, or it might not be completely relevant or whatever. But in general, I think it's I think that would be the way we'd like to take it forward.
Thank you, Simon. Anushka, we have a question from you. Anushka?
You just take yourself off mute. Yeah. Oh, you can't unmute. Okay, ask to unmute. So Anushka's going to write it in the chat. I think, Anushka, if you press Alt-A on your keyboard, sometimes that helps. But in the meantime, we'll listen to Pierre, who's got a question, hand up.
Oh, hi, everyone. Thanks for today, really interesting. And apologies if I've missed this, been on the whole of the call. I was interested in putting together the guidance, whether you'd come across issues around consent and getting people's consent in when you're doing community engagement. We've kind of tied ourselves up in knots recently with this, with quite a sensitive project, and we had someone draft out what became almost quite legalese consent form, and we thought this is just not right. It doesn't feel right at all. So just interested in your experience with that, really.
I will get Ruchit to answer that from the project context, but more generally for engagement, we would advise on an ethics policy, an ethics and engagement policy, but that also includes safeguarding, so that when you're working with all types of individuals, including those who are at risk of being vulnerable, you have got guidance in place to support you to do that, but also be transparent with the people participating in that process. And it can include a range of things around options to pull out whenever they feel comfortable to, and be transparent with you about how comfortable they feel. So, but yeah, I'll let Ruchit explain the ethics side of the research project.
Yes, no, so with universities, before we launch any research project, we have to get ethics permissions from so there's an ethics body. So we had to make sure, in our terms, it was a social science project. So we didn't have a lab where we were testing or there was any medical or any blood sample. So there were different ways, different kinds of forms you have to fill up if you're doing that kind of research. But we did get ethical permissions granted from the University of Reading and successively from the other 3 universities as well. And now as we do that in Cambridge as well. So, but it was mainly about we were collecting people's inputs. And any other personal data would be separated from it, and none of the personal data. So if there were pins on the map, they will be seen as anonymous. So the comments will be viewed as anonymous, and nobody else can trace it back to who it was apart from the select 5 people. And in terms of data protection, how long are you going to keep the data on your university hard drives, or if any printouts, and when are you going to delete them or scrap that. But also, prior to any semi-structured interviews, we would read out all of these consent forms, get necessary permissions, get the signatures. Whenever any of the sessions happened in the urban room or on the green local parks or greens, local squares, we would have a display board saying this is a research project, and there will be photographs and videos. And if anybody doesn't want to be on our social media or any of our reports, please let us know. So there were different kinds of consent which had to be taken in consideration. Also, every time, even after doing all these things, every time we published anything, before getting the publication out, we would share the draft with the people who were either interviewed or were in the photographs and ask them, are you okay, before we publish them. So I'm not sure what kind of exactly troubles which you encountered there, but it would be helpful to share with the team if so then we can learn from each other as well.
Yeah, happy to go offline and share with you.
Sure.
It was just a tricky community project where there were potential issues of safeguarding or abuse coming through inadvertently in our interview process, and what we do about that. I think that was specifically that particular issue, but I mean that was just because it was a particularly troubled community. But for me, it raised issues of crikey. This wasn't what I'd anticipated, you know.
Yeah, no, so I completely understand this. And also prior to working for this, I worked for another research project, which was also a community regeneration project called Everyone Every Day at Participatory City Foundation. And although we think we are doing community good, you'll always have issues which you never anticipated, and these kind of issues. So when we opened up urban rooms, we had a policy of having at least 2 staff, and one of them having a disclosure and the DBS certificate, somebody who's trained to with all the other safety policies, so fire, health, and safety, and getting all the certificates and training necessarily done before that. Also, in terms of only, I think between the 4 nations, only Cardiff had already gotten permissions from their ethics on working with youth and young children. So they were partnering with school children. So they made sure they had got all the necessary requirements in terms of that. And whenever school children were involved, somebody from the school would be always present, at least 1 or 2 people, depending on the number of students who were entering the urban room. So we always make sure that those kind of principles were followed. And also, but there would happen at times that, so for example, in the Reading Urban Room, we had no permissions that any young person would be in the shop without their person who's safeguarding, so either their parent or the guardian. And we had a table tennis sport. So this one person entered with their parent once. They really enjoyed it, and then he started coming in every single day, and we had to actually ask him to leave the premises because we cannot take that responsibility. I mean, it's a fun place to be, but unless you have your legal guardian, you cannot come and play. So we had to deal with these kind of issues. And
Ruchit, the dream of having an urban room that everyone's flocking to, even when they don't need to be there. That's amazing.
Yes.
I've just realized we've only got a couple of minutes left. I was going to read Anushka's very quick question. If anyone has a very quick idea to throw it out, she says, I'm starting a research project at uni about working with communities and how sustainable construction techniques can meet their needs and engage with them so they're interested in adopting them. She's just curious of anyone who has ideas of how they can use the CC Qual toolkits or guidance to do this. Melissa, maybe you're best placed.
I think we've got lots of resources that both myself and Ruchit have been pooling together. So I think we could share some of those after the session. That would be useful for people all round. I think might be the best way.
Yeah.
Yeah.
Get a list of some of those resources, then please do email us and we can send a couple your way.
And Alice has also shared a useful resource in the chat, which we can share with people. And yeah, I think people are starting to drop off because it's lunchtime, so that's fine. I think that's come to a natural close, I think.
Lovely.
Yeah, so I just want to say thank you to everyone for taking part in this associates workshop, and thank you to our speakers on behalf of the Foundation, Ruchit and Simon. We're really happy that you've participated today, and we hope to continue the conversations with you. If you've got any further queries or questions, then please contact us. But yeah, thank you again. Stay in touch and enjoy the rest of your day.
Many thanks, Melissa.
Thank you.
Bye.
Bye.